Thank you, Roger, for your text message.
Okay, so yeah, so we're now recording it for posterity. So just wanted to give you a bit of an introduction to Medequip Connect for those that don't know who we are. As Natalie mentioned, we are the contracted provider for technology enabled care across Derbyshire. Really pleased to be that strategic partner with such a forward thinking local authority that has really got a strong emphasis on leveraging the capabilities of tech and helping people to live independently for longer, and all the benefits that provides. So we're a very experienced provider, provide technology enabled care right across England, and we support a lot of people with those services. We provide the full holistic service model within our technology enabled care services. So we provide everything from assessment, installation, maintenance, the monitoring function, the responder services, and over the last couple of years, it's evolved into proactive and preventative tech as well. So we have a large contact centre that is based up near Bury, near Manchester, and that's a 24/7 operation, handling calls and alerts from right across the country, all different types of alerts from different technologies, different types of service users with different conditions, disabilities, vulnerabilities, and really support those people through that remote technology enabled care service. But we provide the whole service model. So we've got people that are assessing people for their needs and putting in the right technology to support those needs, and having that then monitored from the contact centre, and then a physical response on the ground with the majority of our services across the country. We have highly trained people that are going out when there are situations such as falls and other situations where people need that physical in-person response. So we've got teams of people that are delivering those types of services as well. And I'll come on to this a little bit later on, but the response service and how that works with proactive and preventative tech it really comes into its own, and how you can achieve improved outcomes for people. And the work that we've got upcoming with Derbyshire is going to be really interesting. Model of technology enabled care to provide improved outcomes for people living out in the community. We've got a whole range of technologies that we support through our services. Those monitor all different types of scenarios, from falls to wandering, to different presentations of dementia, mental health, learning disabilities, frailties, the whole wide range of service users and challenges that they have to their health, independence and well-being. So really fantastic service, handling millions of calls and alerts each year, and highly trained people within our services that are really person-centered in their approach. It's very much a care service, and you've got a picture there of some people within our contact centre. There we've got that highly trained team there, just who act as a real lifeline for people and get them the support and help that they need. Mentioned proactive and preventative, which is the focus of today's session. We've very much gone into delivery of proactive and preventive at scale. We're one of the leaders in this space in the tech marketplace, and have really kind of set the benchmark in terms of use of the technology that we have available to us, and building that service delivery model, and we're really excited to bring that to Derbyshire now. So we've been the tech provider for Derbyshire since April 2024. That was when the contract went live. We had an implementation period running from kind of the end of December 2023 up until the formal contract launch in April 2024, and really pleased with how we've worked together with Derbyshire County Council and all of our stakeholders around that service. It was quite a complex implementation for us to provide, bringing together the previous district arrangement and things, and also implementing an analog to digital switch through that implementation. So changing out people's technology from those analog solutions to a fully digital solution across Derbyshire, which was a major step forward. And again, Derbyshire being a real leader in this space, making that commitment to get everyone onto the more resilient and capable digital technologies. Some significant investment made there to provide that switch, and really pleased to ensure that everybody's got that digital connection going forward. So we've 1,600 people across Derbyshire connected to our service. We are carrying out lots of installations as well, so more and more people the packages of technology and around 2,000 installations. So that's really good in terms of the volumes of people coming on to technology enabled care service, and benefiting from the independence that provides. And that's really good, working relationship that we've got with Derbyshire County Council, and all of the stakeholders been involved, I think has been really demonstrated over the last 12 months or so. And I think this Tech Week has really emphasised that. I was at the event on Monday in Matlock, and great to see so many people there, so many people really interested in tech and the benefits that can achieve, and really well attended, some great suppliers, and really great questions being asked during that event, and really pleased to be part of that. And it's really timely because we are in the implementation phase of our proactive and preventative service and responder services, which we're hoping to get all launched in October, which is not too far away. So proactive and preventative, what is it, and how are we delivering this and delivering this at scale? Well, proactive and preventive tech really is taking what we have in terms of reactive technology enabled care. Alerts come from activation of the technology that people have in their home or mobile solutions, and that's just driven by situations arising where people needed to reach out for help. So that could be in the form of a button press from their pendant device. I think everyone will be familiar with technology where people have red button that they would wear on a lanyard or a neck or on a strap, and not all of the buttons are red anymore, which is kind of a good thing, but very much a device that people would activate. And other sensors as well, so things like falls detectors or detectors that would indicate that someone had got out of bed during the night and not come back within a specified time period, or exited their property unexpectedly. Those types of physical kind of alerting technologies through to our contact centre, and those situations would be handled by the team, and the right help would be arranged to support that person. But things have evolved and the technology has evolved, and a couple of years ago we started to work with our partners at Access Group, and really capturing the advances in the technology in terms of digital solutions becoming available, but also much more powerful technologies that could take indications or sensor readings from different more passive sensors within the home, could provide and bring that together into apply some really smart machine learning AI technology to provide a more proactive approach to monitoring a person's activities for daily living. So this has really changed what we can do as a provider of technology-enabled care. And we have utilised the Access Home Hub, which is a multifunctional digital technology-enabled care device. It gives you all of that reactive technology-enabled care ability, but also includes a proactive functionality as well. Which provides our proactive and preventative team within our contact centre with a set of data insights via their platform from the different readings that are coming from the activities for daily living sensors. So I'll call them ADL sensors going forward, so I don't have to read activities for daily living. But really, this has changed the complete focus of what we're able to do from our contact centre, and it's enabled us to have a greater insight into what is happening with people and how they're doing, and how things may be changing with them over time, and not just reacting to more kind of emergency or urgent situations. The Assure platform really captures all of those indicators and establishes a baseline for people. It learns about them and what is the norm for them. It's not a platform that is just reliant on setting up of rules. People may be familiar with some of the other technologies that look at people's activity, and that those have been around for a number of years. They're largely based on rule-based approaches, and having to have a lot of manual kind of inspection of data, whereas the Assure platform has that smart technology within it that gets all of the data together and provides data insights from that data for our team, and is detecting those changes and enabling us to take the right approach in terms of how we need to escalate any of those changes. We've really run with this technology, we've really run with this approach, and really started to present this as a service offer for the industry, and by working with a number of different local authorities, we've been able to start to achieve this type of service at scale, or provide this type of service at scale, and take all of the learning as we've gone through delivering this type of service to really hone and enhance our approach around that. And we've seen some, spectacular results with this type of technology and this type of service delivery model, and we've been able to increase the success of this type of approach as we've gone through and added more people and different types of service user with different conditions and things to this over time. And we've really developed the way that we assess people for this type of service, also utilising access assessment tool as well. We've been able to really formulate packages of proactive and preventive tech that have made a real difference to people's lives. And I've talked about a lot about the technology through the initial stage of this presentation, but always come back to the impact that this makes on people's lives, and the human element within this service model is so important. And assessment being one of the key parts to this service, but also how that preventive team within the contact centre uses the data insights and builds that relationship with service users and their carers and family, their support network, is really front and center to this approach, and really takes it to another level in terms of how we can support people to remain independent, and also how we can support carers to look after loved ones as well has really been changed by this type of service. So we've learned a lot through delivering this service, and we've put in place various different mechanisms to make sure that we're able to provide that service in ever increasing effective ways, and really developing all of the training and procedural side around proactive and preventative tech, and making sure that all of those escalation pathways are really fully established. Because when you have a lot more information about a person that you're supporting, we need to make sure that information is used effectively. And what we don't want to do through a proactive and preventive service is to overload health and social care professionals with lots and lots of data. And this is where the model that we provide at Medequip Connect and with our partners at Access really comes into its own. We have a service that manages those key alerts and changes in behaviours and escalates those appropriately. And when we come on to how that's going to work in Derbyshire, I'll kind of be able to provide some greater insight into how that's going to happen and how that's going to be so managing those alerts and making sure that the right escalation happens. And there's a lot of work and a lot of thinking, a lot of development that has gone into how we provide that approach. And we have across the country where we've developed relationships with other services that we need to interact with our proactive and preventative service. And one of those that's really come into its own has been the urgent community response teams, UCR, across the country. We engage with local teams. They're known by different names in different areas. Some of them urgent community response, but they may be known as by other names depending on where you are in the country. So a health response that is designed to really take that pressure off the ambulance service. A lot of the alerts and interventions that we need to make for people don't require an ambulance response. And because a lot of the service areas in which we operate, we have our responder service. They work in partnership with the UCR teams, and that's been a really powerful collaboration. That's been something that has really led to improved outcomes and taking that pressure off the ambulance service, and looking to avoid hospital admissions, and facilitate hospital discharge as well, as really helping to right size care packages and provide an improved level of support for people. But those kind of key integrations that we've achieved have really paid dividends, and when I come on to how things are going to look like in Derbyshire, we're going to take that a step further, which I'm really excited about. So because we've been providing this service at scale, and it's been really innovative, and the technology is fantastic. The service wrap is really powerful, and we've wanted to the people that are benefiting from the service. We've always been mindful of the need to have people understanding what the service is about and how it operates, and making sure that we've got real transparency around the technology that we use. And everybody seems to be talking about AI at the moment. It's very topical, no matter what industry that you're in, and AI's very powerful AI and machine learning. But people clearly have some concerns around the impact of AI and the use of AI. And one of the things that we decided as a partnership, and with one of the localities, London Borough of Sutton, that we think the recipes for transparency around the use of AI and machine learning tools within government services. It's from the Department of Science, Innovation and Technology, and we were the first application of AI within social care to be registered onto that standard back in January, February time this year, and that was a really important step for us. That was really setting out in the public domain how the technology works and how the human interaction with that technology operates, and that's designed to be able to build trust for all of the people involved with delivery of this service, particularly members of the public, to give that assurance about how the data is going to be used, and how there is human decision making involved alongside the AI and machine learning that is part of the fantastic platform that we use. And being that innovator in this space, and really kind of showing what is possible, the art of the possible with proactive and preventative tech, has led to some recognition, and we've won a couple of awards recently, which has recognised the level of innovation and success in this type of service, and we were really pleased to get those awards with our partners in Access and London Borough of Sutton recently. Because us as a provider have been providing this service for a little while, and the kind of increased awareness around the capability of proactive and preventive tech, this is really starting to be seen as what needs to be the standard going forward. And there was a recent ADAS commission published back in April, which really kind of set the blueprint for proactive and preventative tech in the UK, and really pleased to see the impacts that is starting to have. We are seeing proactive and preventive tech being a core part of technology commissioning now going forwards, and more organisations are really starting to kind of see the potential of this type of service, and the impact that it can have on improving care, the impact that it can have in terms of budgets and return on investment, and where we previously had reactive models of technology in enable care, you're looking around 1 or 2 times return on investment on that technology. What we're seeing from proactive and preventative tech is more like 4 or 5 times in terms of that return on investment. But what I would really emphasize is that we've got improved outcomes for people, and we've recently been seeing situations where we've really emphasized how a proactive model of tech has really provided much improved outcomes for service users and their families and support networks, and that's been ever so important. And we've had some really great case studies and direct service user feedback around how that's made a real difference to their life, and also that of their carers as well. So we've got some evolution that's going to take place, I think, with the way that organisations commission technology now, going from the standards that's going to develop around that, and the work that we do within Medequip Connect and with Access and with partners like the Council is really going to feed into that development of standards and the learning around it going forwards. So we're going to be delivering proactive and preventative tech in Derbyshire. So we're going to start with an initial cohort of people, and we're going to be around the kind of 100-200 kind of mark of people benefiting from the service, and we're going to be providing that full assessment piece. We're going to be identifying people that have kind of high intensity care packages and high intensity use of existing technology enabled care packages, and assessing them for the use of proactive and preventative tech. We're going to ally that with our resource that is going to launch, and providing that fully supported model of proactive and preventative tech. But one of the key things that we're going to be doing is integrating with the health hubs that you have, so the central navigation hub and the local hubs as well is what we're hoping to do. So really kind of taking that learning that we've had from the integration with UCR teams, and looking to share those data insights and the escalations with that key health partner to really provide something that's much more powerful, that we're making even better use of that data, and where we can see a situation emerging with a person, how can we get a better outcome for them, what is the right intervention at the right time, and that's what proactive and preventative tech is all about, really. And this is where we see the future development of proactive and preventative tech, really how it integrates with those kind of health technology devices and the management of conditions and healthcare out into the community. We're all aware of the kind of key priorities for the NHS going forwards, under the well, not so new government, now, but you know, that clear kind of vision for healthcare going forwards being more community based, and healthcare being, you know, not just kind of hospital based, but really being out in the community. The kind of hospital at home approach has real synergies with the proactive and preventative TEC approach, and being able to align, you know, kind of supporting services like how do you support medication compliance, how do you provide video consultation, how do you incorporate people's health and fitness devices, and how do you share that key data that we have on the people that we're supporting with health services and health partners, and really help to manage those health conditions. And you know, a really good example of how we're supporting people from, you know, kind of healthcare perspective has been over these recent summer months when we had the hot weather, and one of the key things that we were doing in some of our London services was picking up on where people's property temperature was getting too high and people hadn't hydrated. We can see that from activity. We have sensors that monitor people's use of electrical devices, so we can see when they open the fridge or use the kettle, and also through our just general interaction with those people, we can talk with them about their levels of hydration, and we've actually been able to provide an intervention that has really kind of influenced a key kind of health metric there. And we see that really continuing into the future as the technology evolves and as service models around health evolve. So really getting you know, just into the data, this is you know, really going to become more and more as proactive evolves, and you know, we're really looking to harness that power of that data to really improve the experience of the service user and their families, and to improve the combined approach for health and social care. You know, we're Medequip Connect is, you know, part of the wider Medequip organisation that provides community equipment services, and we even see potential within that with technology combined with community equipment, data and services becoming more powerful, and being able to kind of forecast demand and things. But really, I think one of the key things around the data will be integrating into health and social care systems. So again, one of the advantages that we have in working with our partners at Access is they provide lots more software systems than just our Access Assure platform. So you know, provide systems like Mosaic and various different care planning softwares, and some software into health services as well. And we see that the key kind of advantage of being able to integrate this really powerful data from proactive and preventative TEC is going to help other health and social care services and professionals to be better informed about the people that they're supporting, and that's really going to improve the way that services link together and work together, and really improve that service user and patient experience. You know, I think everybody has that kind of experience of having to tell your story multiple times to different services and different people, and if you've got data and information around the support that you need as an individual, and that information can be shared in a more effective way, and get you the right help at the right time, and you're not having to, you know, really kind of regurgitate, you know, what is affecting your life and things all of the time, that's going to lead to a better experience. So I'll kind of wrap things up there, and hopefully everybody's, you know, find that interesting and you know, exciting time ahead with Derbyshire. We really can't wait to kind of get things going there, and you know, really demonstrate benefits with the people in our and everyone that's involved services across the county. Thank you.
Thanks, Rupert. That's brilliant. I hope it's helped. Hope you're all kind of enthused about the future of tech and how we can kind of really use it to support people in a new and fresh way, and almost as a kind of wrap around that person, rather than just having to wait for something to happen. We're actually going to get those really great insights that we can share with our health colleagues, and that we can really use to prevent people from getting to crisis. We thought, seeing as we'd got a little bit of time before the Q&A, there's a really short video that Access Assure have created that just gives you a really easy flavour of what it looks like to have that in somebody's home and how it can support somebody. So are you happy to share that for me, Josh?
Oh yeah, that's fine. Yeah, I'll share. Yeah, no worries.
Nerys, you're smiling. Are you proud of me?
I was wondering which one it was actually, but yeah,
it's Meet Jane.
Most of us want to remain independent as we grow older. Supporting individuals to be safe and independent for as long as possible is a challenge every care provider and family faces. Access Assure is part of the solution, the proactive digital care solution that learns the tempo of each individual and supports independent living. Access Assure connects the individual to their families, friends and care professionals. We enable caregivers to provide proactive care for the people they love using deep insights taken from a combination of social alarm and smart sensor technology. Meet Jane. She is 78 and lives independently in Southend. She's becoming unsteady on her feet and needs additional support. Her daughter, Sarah, lives 2 hours away in Milton Keynes. Sarah worries about Jane, but can't always be there for her. As part of Jane's care needs assessment, the local council prescribed an Access Home Hub with 5 smart sensors. Setting up a sensor was quick and easy using the Access Assure app.
This role will be in Derbyshire, so if you're a practitioner, you don't have to worry about that.
Once installed, Access Assure instantly started to learn Jane's daily routines. In just 14 days, Access Assure was spotting unique patterns in Jane's routine. These insights were able to alert Jane's caregivers to gradual, often subtle changes in Jane's routine, enabling days before something more critical might happen to Jane. To widen Jane's care support circle, the council encouraged her daughter Sarah to download the Access Assure app. Sarah easily created a rule to alert her if Jane's front door was opened at night. Sarah also turned on a smart alert to let her know when Jane had started. She was okay. In time, Access Assure began alerting Jane's care circle to a subtle decline in her mobility. Upon reviewing this with her carers, Jane decided that she would benefit from additional daily care support to help increase her mobility and reduce the risk of falling at home. In the Access Home Hub, Jane's carers were able to check in and out with a key fob, reassuring Sarah in real time. One night, Jane wasn't feeling well, so she pressed her panic button. Her Access Home Hub quickly alerted the Alarm Receiving Centre, who, after speaking with her through the Home Hub, decided to dispatch a first responder. With Access Assure, Jane continues to live independently, confident in the knowledge that the council is providing the best possible care support. Access Assure has now been delivered to every care service user's home across Jane's council area, enabling the council to provide a person-centred, proactive care service at scale, and making it easy to ensure that people remain safe and independent for as long as possible. Access Assure, enabling intelligent care insights at the speed of life.
Thanks, Josh.
No worries.
So there's some really brilliant examples of excuse me, where the proactive and preventative approach has kind of really helped in situations. Sometimes it's hard to sort of think about how it might fit into people's lives. But a really great example is with just that reactive tech. If somebody's developing a UTI, for example, they're probably not going to be aware of that. Their carers aren't necessarily going to be aware of that. Their family is, and until they've reached a crisis point, that person could then end up getting confused. They could end up falling, fractured neck or femur in hospital, 6 months in hospital, discharged to a resident care home, which is a really, really poor outcome for that person from something that could have been prevented. So with the proactive and preventative approach, it'll pick up things like she's been to the toilet more often, and it'll pick up those little changes that Medequip will then be able to respond to and sort of get healthcare involved at a much earlier point to prevent that person from getting into crisis. Or somebody with a mental health condition, for example, may have a smart plug on their Xbox. It may be an indicator if they're playing on their Xbox significantly longer or significantly shorter. That could be an indicator of a decline in somebody's mental health, and therefore Medequip Connect could respond and say something's changed here. They're normally only playing on it for a couple of hours, for example. They're now playing on it for 12 hours. Does that mean that they're not going out? Does that tie into other information that has been received from that property? For example, they're not going into the kitchen as much, they're staying in bed more, and it really helps paint that kind of really rounded picture. And at that point, because Medequip Connect will be connected into their health workers, and even if they aren't, they can then push that information through via the central navigation hub to get that person the help that's required before that crisis happens. So really powerful, some really great stories, and along the way we'll be bringing you some case studies of real examples in Derbyshire to bring it to life. Neris.
I was just going to
from Access.
Hi there. I was just going to add an example. So I was at the event on Monday and speaking with, I didn't get the lady's name actually, but a practitioner. It was a real example for Derbyshire of somebody who's like transitioning. I think she was 18 and moving into her own flat with some mental health issues, and it was kind of on the flip side. So not necessarily that she was going to deteriorate, but providing her family with that reassurance that she was, doing well, getting up and hydrating and nutrition and going out in the community. I think she was going to college or something like that. So just using that information, so they didn't have to call her, but they could see it and just in the background kind of know that. The social worker was just like, wow, this would really help that situation and give everybody that peace of mind. So that's just an example to share.
We've got a couple of questions in the chat and some in the Q&A. I'll start with chat because I've got it open. Michael's asked if it uses AI learning to help with the proactive signs. I'll let you answer that, Neris, it's your baby.
Yeah, absolutely. So it learns, the software learns an individual's pattern. If you normally get up at 6 o'clock in the morning, or if you normally get up at 11 o'clock in the morning, it doesn't matter, right? Whatever that individual's pattern is, and then it will show any differences to that normal kind of pattern, and just sort of flag that up to say this has changed, and then so the technology can only tell you that something has changed, and that's where Medequip service comes in to make the proactive outbound welfare check call, contact the next of kin, contact whatever the relevant pathway is to find out why that's happened. But yeah, absolutely, it uses AI to learn that. It also has a sort of an AI summary, so across all the different indicators, so you don't have to look at all the different graphs. It will kind of bring up a summary to say over the month, this person has kept this regular pattern, they've been out 3 times a week, so it's excellent for kind of use in support planning. It summarizes all that. The AI does all the work for you, which is exactly how it should be, and then you use the information to have the conversations and make the right decisions.
Fab. Michael and Lauren have both raised an issue about the rurality of the county and any issues that there are in terms of connectivity. Can either of you come in on that one?
Yeah, I think it's vital to highlight where there's concerns around connectivity, but the device has roaming SIM within it, so it does jump on to the strongest available network, so it's got that functionality within the device, and we fully test the connectivity as well at the point of installation, so that is something that's really verified. The device itself, the actual the Access Hub, really does offer great connectivity, and we've utilised that in very rural areas. So it's something that the whole industry faces, is connectivity being a challenge, but pleased to work with such a great product that really offers that connectivity.
Thank you, Rupert. We've had a question from Emma, who's wondering how tech can be used to support people with a learning disability and autism. I am going to share yesterday's presentation about that in particular with Emma, but if you can come in on how the Access Assure can be used in those kind of environments, that would be brilliant.
Yeah, so we utilised Access and Access Assure with lots of people living with learning disabilities in different settings, both out in the community and kind of supported living environments and things. Really powerful in terms of supporting them, particularly around their routine, and picking up on kind of early indications that something's maybe not quite right, and that they may be having some difficulties or going into a bit of a crisis, and again, I would emphasize is not just the technology, not just the technical side of things, it's also the relationship that we build with that user. Really having that proactive contact with them, to check on how they're doing, making sure that their life is kind of going to plan, that if there's anything that's worrying them, or if they've had any particular situations that they find challenging, and helping to talk them through that, making sure that their support network is aware of things that are happening, or making sure that you kind of link them up with their support network at the right time. That's really where this type of solution comes into its own. Our service generally is looking at how we can help people living with different conditions and disabilities and challenges within their lives, and looking at what technologies are available to help them to cope with those those challenges and getting the right outcome for them. So there's lots of technology that's available for learning disabilities. We work with a range of suppliers around different solutions. There's some really fantastic things around helping people to perform tasks for daily living. We've seen some really great examples where people have been supported with being able to cook and learn different recipes and things, and kind of gain that level of independence, but also helping people with travel, safe traveling, and getting into work and going to college and things like that. So there's lots of different technologies there which help people with their routine, and which is quite often one of the key factors that we need to help people with.
And equally, there's the option to not just have the hub in somebody's home, but to have that as a mobile device as well. So it's not just working proactively in your home. It's got all those proactive features within the home, but then you can take your device and you can get that reactive help when you're out and about as well.
Yeah, and it's why this project that we're working on with yourselves in Derbyshire is really exciting. We've got a mobile option within that project. So again, Access provide the Oyster range of devices. So that mobile solution as well, and that's really powerful. And I know through the time that I've been involved in tech, I've had some really significant outcomes where we've used mobile technologies to help people keep independent, particularly around wandering and property egress and things. We've had some really significant outcomes where we've enabled people to live safely in their own home for longer, when that's been a particular challenge for them and their support network. And we're all aware of the costs of residential care, and also people wanting to stay in their own home for longer, being a really key factor for people. I know from my own father who's living with dementia, that's a key thing for him, is he doesn't want to go into residential care, he wants to live at home, and some of these technologies can really help them to achieve that, and that's massively important.
I'll just very quickly answer the question. Somebody's asked if AI can recognise if the person is a smoker or has certain smoking habits. I said I didn't think there was any sensors that would especially pick up smoking, but am I? Oh, I'm wrong. There we go. That's why I had to bring the question. Lauren, ignore my answer. Rupert Neris, go for it.
So there's an air quality sensor. There's the motion sensors pick up temperature. There's a humidity sensor. You can do all of that. The sky's the limit, really, with these IoT kind of sensors. So light as well, which is a really interesting one. If people aren't opening their curtains, that's possibly an indication. So yes, yes is the answer. I guess it could, from an air quality point of view.
Thank you. And Joe Evans, who is our lead for occupational therapy, is asking if there's a financial cost to the person, and if Access Assure is available now in Derbyshire. We were hoping to start in September, Joe, but we have had a few recruitment issues, but we are confident that in October we should be ready to rock on that. In terms of financial cost to the person, it works in the exact same way as the fully funded, part funded, and private paying. So anybody that currently has a funded care package through us would get that as part of their care package. Somebody that's part funded, that they're currently paying about £2 for their ordinary reactive service. I think that goes up by about £7 if you include the in-person response and the proactive and preventative, but there is the option of just using the in-person response. So that'll all, once it's all ready, it'll all be available within our Connect pages and on the specific workflow as well. Medequip Connect are just waiting to establish our paid for option and getting the responders in place. And then when that's all settled and sorted, they're then going to be offering it as a private paying option as well. So it's a watch this space on it, but we will keep you all informed along the way through the DCC website, through our Connect pages, through our practice bulletin, and anyone that follows me on LinkedIn knows that I post every 20 minutes anyway. So it will be it will be all over there. So please feel free to follow me on LinkedIn if you'd like tech updates. There were no other questions. Let me just go back to the chat. We're slightly out of time, but if there's people still hanging around, that was somebody needing to leave and somebody else wanting the slides. Absolutely, slides can be shared. All of the webinars that have happened across the week will be shared on our Connect pages anyway. So anybody internal will be able to access those. Anybody external that's on the sessions will get the recordings and the slides. If you've missed any of the brilliant sessions that we've had before and would like copies of the presentation or the slides, then please feel free again to drop me an email. We've got one more presentation webinar this afternoon. That's me talking about how tech can support unpaid carers. So please feel free to sign up to that one. It will be lovely to have you there. For everyone that's attended, again, I'll just say thanks so much for giving us your time. Please feel free to reach out if you have further questions after this or want to make some connections. It'd be lovely to hear from you. If no one else has got anything, there aren't any hands up or anything, then oh, that was just a thanks.
Yep. I think
I
we're
thought
all
we had
right
a
now.
last minute question, but no, we're good. So thanks everybody, and hopefully we will see you soon. Thanks
Thanks,
Rupert.
everyone.
Thanks for your input, Nerys.
Bye.
Yeah,
Bye.
thank you so much. Cheers. Bye.
Cheers.
Okay.
And stop the recording.
That's it. I'll stop the recording. There we go.
Ah.